This segment is sponsored by Domain Northside.
Care whenever you need it, in person or even in your PJs. One Medical at Domain Northside is changing the game. They work with your insurance just like a typical doctor's office, but they offer a lot. Dr. Natasha Bouillon is joining us today to discuss their same-day primary care from colds to COVID-19. Good to see you.
Thank you so much for having me.
What is One Medical?
Well, thanks for asking. So One Medical, we are a primary care organization that is membership based. And so it's different because we really do focus on human-centered in-person care, but we also integrate 24/7 virtual care as well. And One Medical was really founded to help remove those barriers that people so often face when they're trying to access healthcare. Rather than waiting weeks or even months to see your primary care provider, at One Medical, you can see your PCP the same day or the next day. And we've really designed our offices to be comfortable for patients. We have spa-like lobbies, our appointments start on time, and patients don't feel rushed. When you see your PCP, you can talk to them about the issues that you're concerned about and not feel rushed. And along the same vein of convenience, we do have labs on site. But another great thing about One Medical is we also offer on-demand primary care virtually 24/7 to be convenient for folks in order to receive access to care.
Yeah, sounds like y'all are creating a really welcoming, warm, and effective setting. You've mentioned technology a couple of times. How does the technology aspect work?
Yeah. And, I've been so happy during this COVID-19 pandemic. Perhaps the one silver lining is that we have seen an emergence of technology, especially in healthcare and primary care settings that are virtual. And really, technology has been kind of part of the One Medical DNA since day one. And so the nice thing about our technology platform is people can access on-demand virtual care 24/7. They can also make scheduled visits with their own primary care provider. They can message their PCP, which is me, anytime they want, get prescription renewals as well on our app. And then we also go far beyond. So rather than just triaging people virtually, we'll also treat them. So we have a Treat Me Now feature where we treat people with skin conditions. They can send us photos, urinary tract infections, other issues related to sexual health. We really just want to make sure that healthcare is as convenient and accessible as possible for people.
Yeah, and it sounds like you're doing just that. I mean, what an intimate and personal way to interact with your primary care physician, who is you in this case. What if someone needs specialty care? You definitely mentioned some scenarios there, but what if it's even more specialized?
Yeah, the nice thing about our specialty care is we do have a partnership with Ascension Seton Healthcare. And so we're clinically and digitally integrated with them. And so what that means is if someone needs specialty care, we have a seamless process for those referrals, for that care coordination, so people can access both primary and specialty care through us.
Mhm. A question a lot of people have right now is it safe to go to the doctor's office if you have non-urgent needs? How do you feel about that?
It's such a great question. It's something that my patients have been asking me. I know that during this pandemic, a lot of people have been deferring their care because they're afraid to go to the doctor's office. And so we've been really thoughtful at One Medical about making sure not only are our offices comfortable, but they're safe for our patients and our team members as well. And so we do have a survey before people even access care to assess their risk level. And of course, our offices are designed with physical distancing in mind, and everybody needs to wear masks. But one thing I love to talk about is it's so important to access primary care now more than ever. We know that people who are more severely impacted by COVID oftentimes have underlying health issues that are uncontrolled. And the CDC released a report that people who have underlying health issues are 6 times more likely to be hospitalized than people who don't when they get COVID. And so it's really important for people to make sure that their chronic conditions are controlled, but also make sure that they are taking care of their preventive care, of their cancer screenings, getting their routine vaccinations. And so I do tell people, I understand if they have some hesitancy in accessing care, but rest assured that we have kept safety in mind. And with all that being said, the other important thing is if people want to access care virtually, they can. They can do that 24/7. And we found that a lot of conditions actually can be managed through things like video visits.
Wow. Well, that's great to hear. And thank you for sharing all that with us and such a thoughtful response to how you have set everything up. Speaking
Mhm.
of COVID-19, what type of care are you providing as it relates to that specifically?
We've had a range of care related to COVID-19. So certainly we're offering testing for COVID. We have different types of tests for our patients, and it's basically offered on an appointment basis. People can pop in and pop out. The testing just takes a few minutes, and then we send people the results immediately on our app. And then we also, of course, take care of people who are diagnosed with COVID. As you may know, the majority of people who are diagnosed with COVID are often managed in a primary care setting. And so we take care of that as well. And then across the nation at One Medical, we are working on vaccination efforts. We've vaccinated thousands of people across the nation, and we're working with local departments of health to make sure that we have vaccines for eligible priority populations. And so really the whole gamut of care when it comes to COVID.
So you are currently at Domain Northside.
Mhm.
Any plans for expansion in the Austin area?
Yeah, we're always looking to grow. So in the springtime, we'll be opening another office downtown on Congress Avenue, and we certainly hope to have more offices after that.
Dr. Bouillon, thank you for all this. I learned so much. It sounds like you are a really great option for people. I appreciate your desire to make healthcare more accessible. Can you remind us one more time how that membership is set up and how someone would become a member if they wanted to?
Yeah, when people think of membership organizations, oftentimes they think of really pricey concierge type practices, and that's not the case with One Medical. So our membership is $199 a year, and so that's about $16 a month. People can go to onemedical.com to sign up and register as a member. And when they become a member, they have that full access to 24/7 care. That on demand virtual care actually doesn't have a copay. And so, what some members find is they actually do have a health savings when they use that on demand virtual care without a copay. And for our in office visits and for our remote scheduled visits, we do bill insurance just like any other doctor's office. So, hopefully, it is accessible for most people.
Well, a really great option to learn about today. Thank you so much for your time. Again, you are out at Domain Northside. What's your website?
You can visit onemedical.com to learn more about One Medical and also register to become a member.
Awesome. Thank you so much. And you can head to domainnorthside.com to learn more about all of the great things they have going on out there. They have created a live, work, play, stay healthy lifestyle with places like One Medical and more. You can head to their website to learn everything going on, or head to Domain Northside on social media for a behind the scenes look at all the great activities out in Northside. We will see you soon. Take care.
Thank you so much.